So the government initiated a study with a guy named David Fisman at the University of Toronto, and this study was so bad, Madam Speaker, that there's a book called Fisman's Fraud, The Rise of Canadian Hate Science, and I just want to know how much money did they spend on these studies to support this Arrive scam when they knew that they didn't have the science to even support it from day one?
Thank goodness it was that Canadians and the majority of the people in the House saw the value of protecting the health and well-being of Canadians, and that the far right was marginalized back then, Madam Speaker, because as a direct result, more people are living today.
Tamara Ugolini here with Rebel News, and in today's interview, I'm discussing the rise of what is being coined as hate science by statistician turned author Regina Watteel after she published the book titled Fisman Fraud, The Rise of Canadian Hate Science, which was referenced recently in the Canadian Parliament. With a PhD in statistics and a Bachelor of Science from McMaster University, Watteel has a strong grounding in the sciences, that is, natural sciences that are grounded in facts and data, not pretend play simulations and skewed modeling. With a specialty in applied mathematics and theoretical physics, Watteel went on to obtain a Master of Science in statistics. She also served as an independent consultant to medical practitioners, social scientists, and various levels of government, alongside teaching both undergraduate and graduate level statistics courses. Before Watteel was severely injured in an accident, she served as a senior and then principal statistician for an economics consultancy firm specializing in risk-benefit analysis and program evaluation. Her extensive experience, particularly with government departments at the municipal, federal, and provincial levels, makes her well-versed in risk management practices. With the onset of the pandemic pandemonium in the spring of 2020, Watteel quickly discovered that data and science were not driving policy decisions or the measures being implemented, but instead, simulation models were used to justify harshly imposed and unprecedented suppressive public health measures. Instead of opting for mitigative measures to cocoon and protect the at-risk, vulnerable elderly populations, hysteria and knee-jerk responses ensued. The federal government, led by Prime Minister Justin Trudeau, who had received multiple COVID-19 boosters and was still experiencing ongoing infections, was struggling to maintain enforcement measures such as the Arrive Can app. This government health surveillance tool has been dubbed Arrive Scam in recent weeks, but worked to effectively restrict the mobility and medical privacy rights of Canadian citizens and continued its segregation of the often demonized unvaccinated. In stepped one of COVID's most prominent pandemic profiteers, conflict of interest riddled and ideologically motivated David Fisman. Fisman describes himself as an infectious disease and epidemiologist and physician registered by the College of Physicians and Surgeons of Ontario, and is also a professor at the University of Toronto's Dalai Lama School of Public Health. Despite Fisman's countless conflicts of interest, his study, Impact of Population Mixing Between Vaccinated and Unvaccinated Subpopulations and Its Implications of Transmission, hit headlines globally. More of "it's a pandemic of the unvaccinated" rhetoric swirled. This modeling was funded by the federal institution and publicly funded Canadian Institute of Health Research, and research was conducted at the Dalai Lama School of Public Health before it was peer-reviewed and somehow published in the Canadian Medical Association Journal, the CMAJ. I had previously dissected all of this in a few different reports, but what Watteel has uncovered in her book is even more disturbing. She's put pieces of the pandemic puzzle together, which she says shows intent to deceive, vilify, and advocate for harm and set conditions for future vaccine mandates. Have a listen.
All right, so what Fisman and his colleagues actually did was they concocted a model to simulate fake data and results that show that the unvaccinated had disproportionately higher incident rates than the vaccinated. And then they passed off these fake results as a true reflection of reality. So that's data fabrication, and that's considered scientific fraud. But more than that, what they did was they inverted reality, because real-world data showed the opposite, that the vaccinated had disproportionately higher incident rates during the Omicron surge. And they knew that this data existed. Many scientists pointed out that their results were contrary to the real world, but they did not use them because they were inconvenient. So that's considered falsification, which is also scientific fraud. And scientific fraud shows intent. You cannot do these things and not know you're doing them. And so you have intent here, and it is also impossible for these establishments, CIHR, CMAJ, U of T, to not know this was fraudulent. So they were complicit in backing a knowingly fraudulent study that was used to demonize and scapegoat millions of Canadians. That is extremely dangerous. And it cuts to the core of the government's pandemic response. All right. So that's why this study was so important. On my first read through, it was very blatant, it was very obvious, and there's no way any respectable establishment should have endorsed this, and yet they did.
So Watteel went to the CMAJ and asked them to investigate this study for fraudulent fabrications of reality. They didn't. She went to the University of Toronto, who also brushed her off, and then she went to the CIHR.
When they refused, I went to CIHR because they funded it. It was, federally funded with government money, and it was used in Parliament to justify extending the travel restrictions. So I felt there was a duty for them to correct the record and to investigate. And when they didn't, I found that completely unacceptable. And by that time, I had looked into a lot of their conflicts of interest, and I realized that this went a lot further than just one fraudulent study. So then I went to the Ontario Provincial Police seeking an investigation from their anti-rackets branch. And when they refused to do so, that's when I decided I would be publishing this book.
Feeling compelled to expose the spread of what she termed hate science during the pandemic, Watteel stresses the importance of protecting the public from such assaults on scientific integrity.
Researchers engaged in hate science, which is the using scientific fraud in order to target and scapegoat a segment of the population, and that there was intent behind that, and that it was backed by the establishment, and that's extremely dangerous and problematic. That the establishment, the journal, the top research institution, and the funding agency, a government funding agency, all backed a knowingly fraudulent study in order to scapegoat millions of Canadians. So the people have to understand that there was intent involved, and my book shows that there was intent. And that is powerful in how we proceed, because we need to establish protections from the establishment if they're willing to engage in fraudulent science.
Watteel explains how modeling superseded hard facts and data.
The beginning of the pandemic is there was a huge reliance on unreliable statistics, so manipulated statistics and faux modeling in order to justify the pandemic measures that we were seeing. All right. But what happened with Omicron, that when Omicron hit, it became obvious to anyone that the vaccines failed to curtail transmission. And it became more difficult to manipulate statistics to show otherwise. So instead of doing that, Fisman basically just made it all up. It was much easier just to fabricate the data and the results you want, and then present those as a true version of reality. So you did see a progression from manipulated statistics to completely making it up, completely fabricating it. So I think, and that happened because things just got worse and worse and worse when it came to the vaccine's performance. And we knew that when these mandates were first introduced in the fall of 2021, at that time it was already very clear that the vaccines did not stop transmission, and you had major outbreaks amongst mostly vaccinated venues under the Delta variant. So that was an issue. And also before the mandates came out, we also seen a resurgence in Israel. So there was a lot of problems right from the beginning, and the science never really backed the mandates at all.
This was proven during a federal court case where it was revealed that Trudeau implemented travel restrictions and mandates based on political science rather than evidence-based science, something that Fisman's simulation scenario supported. Suddenly, it became clear to Watteel that Fisman played an influential role in the pandemic response from the onset.
Honorable committee members, thank you for the privilege of appearing before you. The last several months have offered us as a country extraordinary challenges. As an epidemiologist, internist, and parent, these challenges have subsumed every part of my work life and my personal life. I haven't hugged my kids since mid-March. I have watched patients admitted to hospital with mild breathing difficulties and seen these same patients wheeled into the intensive care unit 72 hours later.
Fisman goes on to explain how his models not coming to fruition isn't a failure of faulty modeling parameters, but rather because the government swooped in to save the day, which Watteel elaborates on next.
Better the government looked in that if you make these outrageous predictions and they don't come true, it must be because the government saved the day with its measures. And this was really a win-win situation. And you see that play throughout the entire pandemic. And I found that quite interesting. In terms of his influence, it was amazing to me that he had so much influence because he wasn't even on my radar until this study. So I never even paid attention to who David Fisman was until I read this study and thought, what's going on? This is so blatantly false. And then I started looking into his connections and realized, wow, he was influential at the municipal, provincial, and federal levels. He had international influence. He was even mentioned in Maclean's 2021 list of most influential Canadians during the pandemic. He was like the top scientist for his forceful voice demanding action. So he was extremely influential. And he basically had outrageous models for everything. He was used. I refer to David Fisman as Canada's front man for pandemic modeling because he was there to back all the government's harsh measures, from the masking to lockdowns to school closures to the vaccine mandates and passports. So his role seemed very clear to me. It was to prop up, government fiction. He actually took fraud to a whole new level. He used fraudulent science to target, to scapegoat vulnerable Canadians. And that it was published in a journal is shocking to me because, like I said, it's a whole new level of fraud. It's a whole new level, and I call it hate science because that was the purpose behind this study.
Watteel then did a deep dive into Fisman's influence tentacles, which she says are accomplices in all of this unfolding.
Right. When you look at these institutions, there was a lot going on, and especially when you look at University of Toronto, they played a pretty central role in the Dalla Lana School of Public Health. Also, a lot of their people were on the Ontario Science Table, and even the university itself had implemented measures that made their affiliations with pharmaceutical companies. You see huge conflicts of interest. They are partnering with Moderna, and the University of Toronto, like many other universities, had received a lot of funding to combat vaccine hesitancy. And so there was a huge amount of, a large conflict of interest with the University of Toronto. And I think that needs to be looked into and investigated.
But how did this happen? How did we get here? The government told us to trust the science, but it turns out that it was mostly political and behavioral science.
We've seen throughout the pandemic that anyone who props up what the government's narrative gets a lot of play. And scientists who go against that are pretty much censored. So it's pretty clear to me this has not been about the science. It's been about who will go along with the narrative. And that narrative has been predominantly political. So you look in my book, and there is a chapter there that the politics dictated the science, and that's exactly what happened during the pandemic. So we see that the government really wasn't following the science in the normal sense of the word. So most people look at the hard sciences as the science, but really what the government was following was the behavioral science and using manipulated statistics and faux modeling to drive behavioral change and to get people to comply with what the government wanted. And that was the main thrust of pandemic science.
And now the political science is shifting and more Canadians are seeing the pandemic profiteers for who they are, as evidenced by a recent mention of Watteel's book in the House of Commons last month.
Our own public officials from the Public Health Agency of Canada did not have the science to support this policy. So the government initiated a study with a guy named David Fisman at the University of Toronto. And this study was so bad, Madam Speaker, that there's a book called Fisman's Fraud, The Rise of Canadian Hate Science. And I just want to know, how much money did they spend on these studies to support this arrived scam? when they knew that they didn't have the science to even support it from day one?
The Honourable Parliamentary Secretary.
Well, Madam Speaker, the mega conservative far right is coming out. These are the anti, these are the ones that still deny the pandemic. And at the end of the day, thank goodness it was that Canadians and the majority of the people in the House saw the value of protecting the health and well-being of Canadians, and that the far right was marginalized back then, Madam Speaker, because as a direct result, more people are living today.
So what's next for Fisman? Well, worryingly, he is now leading the modeling for future pandemic preparedness and response out of U of T's Institute for Pandemics.
And so he will be leading future modeling efforts. So even though he committed fraud, he will be leading the way in the future. And we kind of know where that's going. So that's kind of an important thing to mention.
Combined with the knowledge from the World Health Organization's Director General Tedros Ghebreyesus about the placeholder future pandemic known as Disease X, we know that it's not a matter of if, but rather when the next health threat will come.
There are things that are unknown that may happen. And anything happening is a matter of when, not if. So we need to have a placeholder for that, for the disease we don't know. That may come.
This is why there is a crucial need to address the manipulation of data and statistics, because fabricated results were used to influence government policy that saw the rights and freedoms of Canadians stripped and used as a reward for compliant behavior outlined by the establishment. The blatant conflicts of interest, financial bias, and lack of scrutiny underscore the urgency to expose and prevent future scientific abuses and uphold scientific integrity. I reached out to U of T, CIHR, Fisman, and the CMAJ to inquire about just that, so please stay tuned for their responses in the next report. For Rebel News, I'm Tamara Ugolini. If you agree that these novel injections should be pulled from the market, then please visit our special website at nomoreshots.ca. There you can find credibly sourced and reliable reports on this topic. Sign our petition and also send a form email to Federal Minister of Health Mark Holland calling on him to revoke market authorization for these products at nomoreshots.ca.